Depression and anxiety are two challenges that many people face throughout the world. Women in Pakistan are especially vulnerable to developing depressive disorders because of the structural inequalities present in their environment. In the Western world, there is an assumption that people who live in remote areas live stress-free lives and don't suffer from mental health challenges as much as people in the western part of the world do. In Pakistan, women are struggling with depression and anxiety at very high rates. This is due to the many stressors in their lives, including poverty, gender role expectations, marital stress, domestic violence, hostile in-laws, pregnancy-related issues, and early marriage. Along with the assumption that people in the non-westernized world are not suffering from the modern world's struggles, there is also an assumption that these people in the remote areas do not understand the concept of emotional distress. Both of the assumptions have been researched and found to be incorrect. The people studied in remote areas were found to be more susceptible to developing anxiety and depression. The lack of autonomy and domestic violence is a major factor in the development of anxiety and depression among women in northern Pakistan. Pakistan is a developing country, and about 70% of the country is rural, and therefore the people in these areas have to depend on agriculture for food. There have been major floods over the past few years that have forced people to move to urban areas to find work. One of the cities that many Pakistani people end up moving to is Karachi. Of the 14 million people who live in Karachi, about 40% of them live in squatter settlements, and there are issues of poverty, overcrowding, and overall poor living conditions. All of these factors can influence the development of mental health issues such as depression and anxiety in this population. Mental health challenges that women face are mainly due to their gender roles and responsibilities, and they result from cultural and social factors prevalent in their environment. Stress is created because of the many roles that women are expected to play and the gender-based discrimination they endure. Other factors such as poverty, hunger, malnutrition, and domestic violence combine to account for their poor mental health, especially in low-resource settings of the developing world, such as Pakistan. Marriage issues is one of the main contributors to the poor mental health of women in Pakistan. In Pakistan, a woman's life is dependent on her marriage and therefore her relationship to her husband. Things like a woman's social security and financial success depend on the success of her marriage. If the marriage is not successful, or the woman is suffering from abuse, domestic violence, little to no connection with her husband, or other similar issues or situations, her mental health can be affected. Multiple studies have been done that have found that there is a high prevalence of domestic violence and dissatisfaction of women in their marriages in Pakistan, which can account for the high rates of anxiety and depression. Pregnancy-related issues were also found to be one of the factors that contributed to anxiety and depression among Pakistani women. Unplanned pregnancies, medical problems of newborns, and difficulties with breastfeeding can all contribute to postpartum depression, which many people in Pakistan suffer from. Domestic violence and issues with in-laws are another contributor to women's mental health struggles. Domestic violence and low social support can contribute to adverse mental health outcomes among women. Verbal and physical abuse by in-laws, which is something many Pakistani women have been subjected to, can also lead to high rates of depression and anxiety. There are significant correlations between the lack of autonomy and marriage rights, as well as poor living conditions, and the prevalence of depressive disorders among Pakistani women.
Because of lack of access to education, women and girls become vulnerable to gender domestic violence. They have to endure violence because of poverty and because of lack of access to information.
Women in Pakistan face many challenges that increase the risk for anxiety and depressive disorders. Some of these challenges include gender roles, inequality, domestic violence, and poverty.